Hello, everyone, and welcome. I am Dr. William Lee, and today we are going to discuss a silent epidemic that is affecting millions of people around the globe, often without them even knowing it. Today's video is all about insulin, the master hormone of metabolism, and there are 12 warning signs that your body might already be developing insulin resistance. What makes this topic so critical is that most of these signs have nothing to do with blood sugar levels. This is a crucial distinction that often gets missed in conventional health screenings. Now, this isn't something that only affects people with diagnosed diabetes. In the modern Western world, some degree of insulin resistance affects the majority of adults, yet it remains largely undetected until significant damage has occurred. In fact, your standard blood sugar test can be completely normal, and you can still very much have some element of insulin resistance and be on your way towards type 2 diabetes. This is a disease that roughly doubles your risk of heart attacks and strokes and can shorten your life expectancy by up to 10 years if left unmanaged. The reason this matters so much is because most people, when they are eventually told that they have insulin resistance or prediabetes, never really saw it coming. It is not because the warning signs weren't there. It is because nobody ever told them what to look out for. By the time your blood sugar finally shows up as abnormal on a standard blood test, the underlying problem has usually been developing quietly in the body for years, sometimes more than a decade. This isn't a switch that suddenly flips on the day a diagnosis appears in your medical record. It is a spectrum, and all of us are on this spectrum somewhere. As insulin resistance gradually worsens, it starts to affect your blood vessels, your liver, your brain, your kidneys, and your metabolism long before anyone calls it diabetes. In other words, what I am trying to say is that the damage doesn't start when the diagnosis happens. The diagnosis is simply the point where modern medicine finally notices the overflow. This is the point where we start getting involved, which clearly isn't good enough for optimal health. We need to be proactive, not reactive. So today, I am going to walk you through 12 signs that your body might already be showing. These are signs that often appear long before your blood sugar ever rises. I will be referencing insights from leading metabolic researchers, including work from Harvard Medical School, the Mayo Clinic, and renowned physicians like Dr. Jason Fung and Dr. Mark Hyman, to ensure that the information you are receiving is grounded in rigorous science. If you stay until the end, I will tell you about specific blood tests that you can discuss with your healthcare provider that can give you a much clearer picture of what is actually happening with your metabolism, often years before problems show up on a standard blood test that your doctor would normally do. This knowledge is power, and understanding your body's signals is the first step toward reclaiming your health. Before we get into the 12 signs, we just need to quickly explain what insulin resistance actually is at a physiological level. Now, if you have heard this a million times before, then feel free to mentally skip over this step, but understanding the mechanism is key to understanding the symptoms. When you eat, your blood sugar rises, which is normal, and your pancreas releases a hormone called insulin. Now, insulin's job is to essentially act like a key. It unlocks your cells so that glucose can get in and be used for energy. That is the normal process. Specifically, insulin binds to receptors on the surface of your cells, triggering a cascade that moves GLUT4 transporters to the cell membrane, allowing glucose to enter. Now, when you have been eating in a way that keeps insulin constantly elevated, so lots of processed food, lots of sugar, lots of refined carbohydrates, barely any exercise, barely any fiber, over time, your cells start to become a bit deaf to that signal. They stop responding properly. This is the definition of resistance. So your body goes, okay, fine, and it just pumps out even more insulin to compensate. This is called hyperinsulinemia. And for a while, it works. Your blood sugar stays normal because of that extra insulin. Everything looks fine on paper because insulin is still just about doing its job, albeit under extreme stress. But this is the really important part. So for years or even decades, sometimes someone can be becoming progressively more insulin resistant and their blood glucose will look completely normal because insulin is compensating. It is working overtime. But the moment that your blood sugar starts to creep up on a blood test, The moment your GP calls you and says that your fasting glucose is a bit high or that your HbA1c is in the prediabetes range, that is the moment the insulin can no longer keep up. The compensation has failed. It is a bit like a dam that is holding back rising water. For years, it keeps the level looking normal downstream. But behind the wall, the pressure is building slowly. And the moment the water starts spilling over the edge, that tells you the system has already been under strain for a very long time. Dr. Peter Attia often discusses this concept of the lag time between metabolic dysfunction and clinical diagnosis. Just think about this for a moment. Think about how significant this is. A hormone whose entire job is to regulate your blood sugar has been pushed so hard for so long that it can no longer do what it is supposed to do. Now, that is not a minor thing. That is really, really serious. That is your body telling you that elevated blood sugar and elevated insulin have done real damage. So no, a normal blood sugar does not mean that you are in the clear. And this is really important. What you want to look out for are these 12 signs. Okay? Starting with number 1, which is that you are hungry again really soon after eating. I am not talking about just a bit peckish within a few hours. I mean actually hungry within an hour or two after finishing a full meal. And the reason this happens is quite specific. So when you eat, especially something high in refined carbs or sugar, which is pretty much all ultra-processed food these days, your insulin spikes really sharply and quickly. And if your cells are resistant to that insulin, then glucose doesn't get into them efficiently. So your blood sugar drops back down really fast, sometimes lower than it started. This is known as reactive hypoglycemia. And what happens is that your brain interprets that drop as an emergency and sends you straight back to the kitchen for some more food. It is a survival mechanism gone wrong. So if this is a regular pattern for you, eating a decent meal and then still wanting more food an hour later, then that is really worth paying attention to. If you compare that to somebody who eats lots of fiber and roughage with every meal and lots of protein and really healthy fats, then this isn't really a problem that we see in these kinds of people. Fiber slows gastric emptying and blunts the insulin spike, providing sustained energy. Dr. Mark Hyman emphasizes that stabilizing blood sugar is the key to eliminating constant hunger. Moving on to number 2, which is all about your cravings specifically for carbohydrates and sugar. Now, I do not really mean the occasional fancying something sweet after dinner. I mean the kind of cravings that feel almost compulsive for bread and biscuits and sweets and cakes and chocolate, for anything really starchy or sweet or high in refined sugars. And this is driven by the same instability in your glucose levels. So when your blood sugar is swinging up and down repeatedly throughout the day, your brain keeps demanding quick fuel to stabilize it. And the quickest fuel available is always carbohydrate. So the cravings become self-reinforcing. You eat carbs, then you spike, then you crash, and then you crave more carbs again. It is this vicious cycle, and insulin resistance sits right at the center of it. Some researchers even compare this to an addiction model where the dopamine reward system is hijacked by sugar spikes. Dr. Vera Tarman has written extensively on how food addiction mirrors substance abuse driven by these metabolic dysregulations. Breaking this cycle requires removing the trigger foods that cause the spike in the first place. Number 3 is all about these energy crashes and dips during the day. So feeling wiped out after meals is one of the most common things that people describe, and most of them have no idea that it is actually a metabolic sign. So you eat lunch, and then by 2 in the afternoon, you are fighting to keep your eyes open. You are reaching for your coffee. You are needing something sweet to get through the afternoon. What is happening is that your insulin is surging after you are eating. Your blood sugar drops in response, and your body essentially runs out of available fuel. Now, a lot of people just accept this as normal, as just being tired or overworked or just needing the afternoon coffee. But on the whole, this isn't normal. It is a pattern, and it is one of the earliest signs of insulin resistance. Your mitochondria, the power plants of your cells, are struggling to access energy because the door is locked by resistance. Restoring metabolic flexibility allows your body to switch between burning sugar and burning fat for fuel, eliminating these crashes. Number 4 is brain fog or difficulty concentrating. Now, this one is a bit harder to pin down, but people describe it pretty consistently, which is difficulty focusing, feeling mentally sluggish, not being able to think clearly, particularly after eating something heavy in carbohydrates. And I guess this is quite similar to the previous point. Now, as I've mentioned in many other discussions, your brain is one of the most metabolically demanding organs in the body, and it runs on glucose. But it needs a stable glucose supply, not the kind of roller coaster that you get with insulin resistance. When your brain cells are also becoming resistant to insulin, which does happen, it starts to affect how clearly you can think during the day. Some researchers have actually started calling Alzheimer's disease type 3 diabetes, which tells you something about how seriously the link between insulin and your brain health is being taken. Dr. David Perlmutter, a renowned neurologist, has highlighted how chronic inflammation and insulin resistance are key drivers of cognitive decline. Protecting your brain health starts with protecting your metabolic health. Number 5 is all about your waist size getting bigger, even if your overall weight hasn't changed much. And that is a really important distinction. The number on the scales might look the same, but if your waist measurement is creeping up over months and years, then this is really important. Your visceral fat, which is the fat that accumulates deep inside your abdomen and around your organs, is one of the earliest and most strongly linked physical changes in insulin resistance. It is not the type of fat that you can pinch under the skin. It is the fat sitting around your liver and your intestines, your heart, and it is metabolically active. It releases inflammatory signals that make insulin resistance even worse. This creates a feedback loop of inflammation and resistance. A really quick way to check this at home is to measure your waist to height ratio. So measure your waist at the level of your belly button and divide it by your height. So for example, if you are 180 centimeters tall, then your waist should ideally be below about 90 centimeters. Keeping this ratio below 0.5 is a strong indicator of metabolic health. Number 6 is struggling to lose weight despite doing what seems like all the right things. And this one obviously is really frustrating for so many people because they are putting in lots of effort. They are exercising, they are trying to eat better, and the weight just isn't shifting the way that they expect. And there is a really good physiological reason for that. So insulin fundamentally is a fat storage hormone. When insulin levels are chronically elevated, your body is more inclined to store energy after meals and less inclined to release fat from storage between meals, if that makes sense. You cannot burn fat when insulin is high. It is biochemically impossible. Now, that doesn't make weight loss impossible. It absolutely can happen, but it can make the process a lot harder. One of the most helpful things that you can do here is to focus on meals that are higher in protein and fiber and lower in refined carbohydrates, because that keeps insulin levels more stable throughout the day. And honestly, the best way to achieve that goal actually is to become really interested in cooking and look forward to making really colorful and vibrant meals with lots of texture and roughage and good sources of protein and healthy fats and legumes and grains and ingredients that you have never used before. It is worth spending some time, exploring these dietary patterns that we know are consistently linked with better metabolic health. Things like the Mediterranean style diet. In fact, a really simple step that you could do this week is to treat yourself to a recipe book that focuses on fiber-rich, protein-rich cooking and start experimenting in the kitchen. Small changes in composition lead to large changes in hormones. Okay, number 7 is a bit of an odd one, and people are often a bit surprised when I mention it, and it is all about skin tags, which are these small, soft little skin growths, usually around the neck or the armpits or the groin, and these are commonly associated with insulin resistance, and there is a biological reason for it. So insulin at high levels acts as a growth factor. It stimulates cell proliferation. Basically telling cells to grow and divide in the skin. This can show up as these small benign growths, benign meaning non-cancerous. Now, 1 or 2 skin tags is pretty common, and it doesn't really mean much, but if you have got multiple ones appearing, particularly around the neck or the armpits, then it is worth thinking about why they are appearing. And if you have got any of the other signs mentioned in this video, then you need to start thinking about insulin resistance. Dermatologists often see this as a cutaneous marker of internal metabolic strife. It is your skin telling you what is happening inside your blood. Number 8 is another one to do with your skin, and it is these darkened skin folds. Now, this is a condition called acanthosis nigricans, and it shows up as dark, slightly thickened, velvety patches of skin, most commonly around the back of the neck or in the armpits again, and it can look a bit like a shadow that won't wash off, or like the skin has become tougher and darker in those areas. And it is caused by high insulin levels stimulating your melanocytes, which are these pigment-producing cells in the skin. And it is a direct physical response to chronically elevated insulin. GPs and dermatologists are trained to look for this because it is considered a classic sign of significant insulin resistance. So if you have noticed this and you have just dismissed it as just a benign skin thing, then it is worth having a conversation with your doctor and getting somebody to look at it for you. It is not a hygiene issue. It is a hormonal issue. Treating the underlying insulin resistance often causes these marks to fade over time. Moving on to number 9, high blood pressure. So, insulin resistance doesn't just affect your blood sugar, it affects the cardiovascular system in lots of different ways. High insulin levels cause the kidneys to retain more sodium, which raises your blood pressure. Insulin also has a direct effect on the walls of your blood vessels, making them stiffer and less responsive. And it also activates the sympathetic nervous system, which is the fight or flight system, which drives your blood pressure up as well. Now, lots of people discover they have metabolic problems, not because they were looking for them specifically, but because high blood pressure was flagged at a routine appointment. The two conditions, which are high blood pressure and insulin resistance, are so commonly found together that one should always make you think about the other. This cluster of symptoms is often part of what is known as metabolic syndrome. Managing blood pressure often requires managing insulin first. Number 10 is abnormal cholesterol, specifically high triglycerides and a low HDL. So if you have had recent blood tests and you have been told that your cholesterol is a bit off, then it is worth knowing what pattern to look for. And like I said, the classic picture here is high triglycerides and a low HDL, which is the good cholesterol. What happens is that the liver, overwhelmed by excess glucose, starts converting it into fat and releasing it into the bloodstream as triglycerides. At the same time, your HDL level falls as well. So this combination, which is high triglycerides and a low HDL, is a really strong metabolic signal, and it often shows up years and years before your blood sugar ever rises. If you have seen this pattern on your blood tests and your doctor was only really focused on your total cholesterol or your LDL, then it is worth asking specifically about those two numbers. And if you have had blood tests and you have never seen your results yourself, then request a copy from your doctor so you can go through them and really understand what each one means. Dr. Thomas Dayspring, a lipid expert, often notes that this ratio is a better predictor of heart disease than LDL alone in the context of insulin resistance. At this point in number 11, we are getting a bit more obvious and a bit more serious now. So this one is prediabetes, or rising blood sugar on a test. This is the point at which insulin resistance starts to show up on a standard test. An HbA1c that has crept up into the prediabetes range, or a fasting glucose that is slightly elevated. And as I explained at the start, this is when the compensation has finally started to fail. This is when the dam is beginning to overflow. The underlying problem has been building for years and years. But, and this is the important point, prediabetes is also one of the most reversible points on this spectrum. Once you are into full type 2 diabetes, yes, you can still make some changes, but the earlier that you act, the better. Prediabetes shouldn't be treated as a minor finding or a near miss. It is a clear signal that significant things are happening. The CDC estimates that millions have prediabetes and most do not know it. This is your warning shot. Take it seriously. And finally, number 12, which is fatty liver disease. Now, this one is obviously one of the more serious consequences on this list, and it is becoming increasingly common largely because insulin resistance is becoming more common as well. So, when your cells are resistant to insulin, and they can't take up glucose properly, the liver ends up having to deal with the overflow of that, and it converts the excess glucose into fat, as I mentioned earlier, and it stores it within its own cells. And over time, fat accumulates in those liver cells, which is a condition known as non-alcoholic fatty liver disease. And that can actually progress into inflammation and then scarring, and then in some cases to cirrhosis or even liver failure. And yes, people can die from this. Now, the most alarming thing is that most people with fatty liver disease have absolutely no symptoms, and they have no clue this is happening. It is often only picked up incidentally on an ultrasound done for something entirely different, like pain in another part of the tummy, or through mildly raised liver enzymes on a routine blood test. So if you have ever been told that your liver enzymes are slightly raised but nothing to worry about, we will recheck them in a year's time, then this is why this matters. Your liver is the chemical factory of your body. If it is fatty, your metabolism is compromised. Now, after all of that, the really encouraging thing about insulin resistance is that it is one of the most reversible metabolic problems that we see in medicine. You do not have to overhaul your entire life overnight to start moving things in the right direction. Just 2 changes alone can make an absolutely massive difference. The first one is increasing the amount of fiber and protein in your meals. We know that fiber slows down the absorption of glucose from your gut, and protein stimulates your satiety hormones that keep you fuller for longer. So together, they blunt that big glucose and insulin spike that drives this whole process in the first place. The second change is simply walking after meals. Even just 10 minutes after eating helps your muscles to take up glucose out of your bloodstream and use it for energy, which means that your body doesn't need to release as much insulin to remove that glucose. It is a really small habit. It is incredibly simple, but metabolically it is incredibly powerful. Those 2 things alone, so more fiber and protein and a short walk after eating, can significantly stabilize your blood sugar and start improving insulin sensitivity over time. Research from Stanford University has shown that post-meal walking significantly reduces glucose spikes.